Angina is different to a heart attack. The main difference is angina is a lack of oxygen to your heart muscle, and it doesn't actually result in death of the heart muscle cells, whereas a heart attack is actually technically when your heart muscle dies. So that's the difference between angina and a heart attack. Angina is usually caused by a narrowed artery that supplies your heart muscle, and it's usually worse with exertion, because with exertion your oxygen demands for the heart go up. So that's the sort of the typical scenario. It's usually associated with some breathlessness and chest pain, sometimes radiating down the left arm, and it usually gets better with rest. But having said that, some people get chest pain that's angina that's at rest, and so there are different presentations. So just because you don't get it with the exercise doesn't mean it's not angina.
Once where they've decided that there could be a cardiac issue there, they will be done a lot of testing. So some of these testings can be things such as exercise stress tests where you go on a walker. Then there may be other tests that patients have to go and have, such as an angiogram or a CT scan or other things that the patients can go and do.
Often the cardiologist will go on and perform a stent if there's an artery that's suitably narrowed, and this involves putting a small tube up in through the catheter with a tiny balloon on the end and a small metal sleeve on that called a stent. And this is passed up the artery the same way as the angiogram and lined up with the narrowed segment on the artery, and then the cardiologist will pump a small amount of contrast and saline fluid inside that balloon and actually open up the artery that has the blockage. When this tube comes out, there are two ways of preventing bleeding from the groin. One is to use what's called a closure device, which is a little collagen plug which is left in where the actual hole was created in the artery, and this gradually dissolves over about 6 weeks. The traditional method is to use a clamp which is applied to the groin for about 10 to 15 minutes to stop bleeding, which is the main complication with coronary angiography.
I'm afraid that cardiologists do prescribe a lot of drugs, and we have to explain these to our patients. There is no doubt that if you have had a heart attack, you are going to be coming out of hospital on about 5 drugs. You're going to be on aspirin, and you may be on aspirin plus a super blood thinner, aspirin-like drug. You'll be on something for your cholesterol. You will be on a tablet that takes the load off the heart, known as an ACE inhibitor or something similar. You may be on a beta blocker, but if you are not on a beta blocker, you may have had asthma, or you may have gone to a different hospital which believes that there's an alternative calcium channel blocker that you should be on. Both are valid, and suddenly we're on about 5 tablets. This is going to be something that will be for a long time. Hearts don't just get coronary disease, and often people can present with a problem that their heart can't get blood out of the heart because there's a narrowed aortic valve, for example, or it's inefficient in its pumping because there is a leaking valve, a leaking mitral valve. And these valves in the heart can be affected by factors such as rheumatic fever, or they can be affected by degenerative change, so that a person might have been born with a slightly abnormal aortic valve. They were perfectly fit and well apparently as they were growing up, but this double leaflet rather than the 3 leaflet aortic valve starts to calcify and narrow off as they get older, or it might calcify and start to leak as they get older. And so that person might need their aortic valve replaced. And depending on the age of the patient, the replacement might be with a tissue valve or a mechanical valve. The mechanical valves will require blood thinners, warfarin. Tissue valves don't require blood thinners of that sort. They may require aspirin depending on circumstances, but we'd tend to use mechanical valves in young people because those mechanical valves last for 30 or more years, and the tissue valves might be more of a 15 plus years before they start to calcify and become less efficient. There are times when we put a tissue valve into a young person, and we would do that perhaps in a 20-year-old girl who needs her valve replaced, but she wants to have a family. So we would replace it with a tissue valve, knowing that in 10 or 15 years' time, we will have to put a permanent valve in, but she's had a family by then. Because you can't really have family if you're on warfarin. So you've got to sort of plan a little bit around the edges. It's a little bit of different planning for girls than boys.
We have an action plan for people that get angina, that is, the pain in the chest, or we have an action plan for people with a chronic condition like heart failure. So once again, it's tailor-made to their specific condition. With angina, what we use with an action plan is to when to use their Anginine under the tongue or the spray, and when to seek help.
The best thing to do if you've been prescribed some spray or a tablet, that you sit down and rest immediately when that pain is the onset of pain. You sit down and rest and use probably the minimum dose first of your medication. So that may be a quarter of a tablet to start off with, or one spray. But just bearing in mind that you need to tell somebody as well. Sometimes with these sprays, what they do is they cause a vasodilation. So what happens is the blood pressure can drop quite quickly. So the reason for sitting down is that sometimes you can become a little bit giddy. So once you've taken that medication, whether it's and you need to place it underneath the tongue for both the spray and also the tablet, is to wait for 5 minutes. If that pain is still there, you may repeat the process. After that 10 minutes, if that pain has not disappeared or it hasn't reduced, you really need to call an ambulance, and that is calling 000. You wait on the phone and they will discuss your symptoms with you, and that's really where the treatment starts, and the ambulance will be on their way.